Hello, today we're going to talk about early signs of Alzheimer's disease. Alzheimer's disease is a progressive brain disorder that affects memory. It also affects your thinking and your behavior. Alzheimer's is the most common cause of dementia among older adults.
Time should we leave tomorrow?
I think about 8. What do you reckon?
Yeah, that sounds about right.
The exact cause of Alzheimer's disease is not yet fully understood. It is believed to involve a complex interplay between genetics and environmental, as well as lifestyle factors. The disease is characterized by the gradual loss of neurons and synapses in the brain. This leads to the cognitive and behavior symptoms that worsen with time. While there is currently no cure for Alzheimer's disease, there are treatments available that can help manage the symptoms and improve the quality of life of these patients. In this video, only the early signs and symptoms of Alzheimer's will be discussed. More details about genetics and treatment will be covered in future videos. By the way, my name is Tia Maria and I am with ACL Medical. Early signs and symptoms of Alzheimer's disease. Okay, here we go. 1. Memory loss. Memory loss is one of the most common and noticeable symptoms. Early on, the memory loss is often mild and may involve forgetting recent events, conversations, or even appointments. Over time, the memory loss tends to become more severe and can include forgetting important information such as phone numbers and addresses, even the name of those close family members or friends. In some cases, individual Alzheimer's disease may forget to perform basic tasks, such as brushing your teeth or getting dressed. Memory loss in Alzheimer's disease typically affects short-term memory more than the long-term memory. Patients may also experience what is called memory confabulation, filling in memory gaps with false or made-up information, leading to confusion and disorientation. As Alzheimer's disease progresses, memory loss can become so severe that it interferes with a person's ability to carry out daily activities and maintain relationships with loved ones. Number 2, difficulty completing familiar tasks. The difficulty completing familiar tasks is another common symptom of Alzheimer's disease. It can include tasks that were once routine and automatic, such as cooking, cleaning, grooming, etc. Patients may have trouble performing familiar recipes or preparing meals even if they've done it many times before. They may also have trouble completing tasks that involve multiple steps, or following a sequence of instructions. People with Alzheimer's disease may struggle to perform self-care tasks, such as bathing, dressing, or brushing their teeth, as they may forget how to do these tasks. They may also have difficulty with household tasks, such as doing the laundry or cleaning the house. They may require assistance or supervision. As Alzheimer's disease progresses, the difficulty completing familiar tasks becomes more pronounced, and individuals may require more support and systems to carry out these activities. Number 3, confusion about time and places or difficulty with orientation. The confusion about time and place is very common symptoms of Alzheimer's disease, especially as the disease progresses. Patients may have difficulty remembering the day, the date, or the time of the day, and may become disoriented about where they are and what they're supposed to be doing, and they forget their appointments or their social engages, or become confused about schedules and routines. Individuals with Alzheimer's may also have difficulty in spatial orientation by just getting lost in familiar places or not recognizing familiar landmarks. Patients may have trouble following directions or navigating warm environments, and may become easily disoriented and confused. Individuals with Alzheimer's disease may also experience changes in their sleep pattern, such as sleeping during the day and being awake at night, which can contribute to confusion about time and place. As Alzheimer's disease progresses, the confusion about time and place, or difficulty with orientation, can become more pronounced, and individuals may require more assistance and supervision to navigate their daily lives. Number 4, trouble with language. Trouble with language is a common symptom of Alzheimer's disease, especially in later stages. Individuals with the disease may have difficulty finding the right words to express themselves, or they may even forget the names of common people. They may struggle to follow conversations or have difficulty following complex situations or directions. They may repeat phrases or questions over and over and over again, or they may struggle to express themselves in a clear and coherent way. Patients with Alzheimer's also have trouble understanding language, including written and spoken language. They may misinterpret or misunderstand what others are saying, or have difficulty understanding the plot of the story or the conversation. The trouble with language can become more pronounced, and patients may become increasingly isolated and frustrated due to the difficulty communicating with others. Number 5, problem with spatial relationships or visual images. The problem with spatial relationships and visual images are common symptoms of Alzheimer's disease, but usually in the later stages. Patients may have difficulty judging distances or perceiving depth, which can make it challenging to navigate their surroundings or complete tasks that require spatial awareness. They may also have trouble recognizing faces or objects. These faces or objects can be familiar from them, which can be particularly stressing and isolating. The patients may also have trouble with visual and spatial tasks, such as the task of drawing, assembling puzzles, or reading maps. They may also have difficulty with perception, such as distinguishing colors, shapes, or recognizing patterns. As Alzheimer's disease progresses, the problem with spatial relationships and visual images can become more pronounced, and that individual may require more assistance and supervision to navigate their daily lives and activities. Number 6, poor judgment. Poor judgment is a common symptom of Alzheimer's disease, especially in the later stages. Patients may make bad financial decisions, such as giving away money to strangers or falling for scams. They may also have trouble managing finances, including paying bills or balancing their checkbook. Poor judgment can be manifested in other ways, such as making inappropriate comments or behaving in social inappropriate ways. Individuals with Alzheimer's disease may have difficulty making decisions. They may also have trouble with problem solving or planning, and may struggle to carry out complex tasks or projects. Number 7, misplacing things. Individuals with Alzheimer's disease may forget where they put common objects, such as keys, eyeglasses, or a wallet, and may become frustrated or anxious when they cannot locate them. They may also put things in odd places, such as putting the TV remote inside the refrigerator or the car keys in a shoe. Misplacing things or putting them in odd places can be particularly distressing, as individuals with this disease may have difficulty retracing their steps or remembering where they put things. Number 8, changes in mood or behavior. Especially in the later stages of disease, patients may become increasingly anxious or agitated, especially in unfamiliar situations or when their routine is disrupted. They may also become increasingly withdrawn or isolated, avoiding social interactions or activities previously enjoyed. Depression is also common with individuals with Alzheimer's. Feelings of sadness, hopelessness, and worthlessness. Changes in mood or behavior can be particularly challenging for caregivers, as they may be difficult to fix or manage. Alzheimer's disease is a progressive disorder that primarily affects memory and cognitive functions. Memory loss, difficulty completing familiar tasks, confusion about time and places, trouble in language, problem with spatial relationships and visual images, poor judgment, misplacing things or putting them in odd places, and change in their mood or behavior. These symptoms can manifest in different ways. It is important to know that Alzheimer's disease is a complex condition and affects individuals differently, and a healthcare provider should be consulted if they are concerned about cognitive functions and memory loss.
What time should we leave tomorrow?
Eight. I think we should leave at 8. Look.
Thank you for watching, and please don't forget to subscribe and ring the bell to get a notification when there's a new video and be the first to watch. Bye.